I'm Alexandra Jones, the editor of The Ophthalmologist, and I'm here today with Dr. Morgan Micheletti. He's an ophthalmologist at the Berkeley Eye Center in Houston, Texas, in the US. Hello, Dr. Micheletti. Thanks a lot for agreeing to talk to me about your innovation.
Hello, good morning.
So first of all, could you tell me about your product? What was your original idea and how has it developed?
Absolutely. So for the most part, we're, adult patients, cataract, a lot of refractive surgery. I do see some unusual cases from time to time, or more challenging cases that have been referred to me, such as a dislocated IOL, or just a complex cataract, for instance. But for the most part, I'm seeing cataract age patients, or patients who are looking to just see better in general from a surgical standpoint.
Thank you. And once you had the idea for your product, how did you hope to develop it further?
Absolutely. So mid-surgery, I was in a case and I thought, man, it sure would be nice if I could do this, which is to create just a small hole in the lens to help in recentering it, as opposed to just throwing a loop around it. I was having some trouble recentering it and getting that knot just right. And so kind of after the case, it just sort of popped into my mind as I was working with my kids and they were using a hole punch for a school project. And, they just kind of put two and two together and said, you know what, why don't we just try for a hole punch inside the eye? And sure enough, that's exactly what we did.
And how did Diametrics help you evolve your idea?
Well, I was very fortunate. I had met some of the people from Diametrics previously. And so I reached out to them first. They're a company nearby me. And so that was very convenient. And just in talking to them, they were very willing to take my ideas to the next level without much further conversation. And that was very, very beneficial to me. I mean, I could continue working on my practice while letting Diametrics do what they do best. And that's take ideas and turn them into products. I mean, what was so amazing about working with Diametrics is I came up with the idea in January of 2021. I think we had a working prototype in March of 2021, and we were using it on the first patient in May of 2021. I mean, to go from idea to functional product in 4 to 5 months is really remarkable. And that's the role that Diametrics can play for really any ophthalmologist with an idea.
Now, innovators have certain expectations with regards to their development process. Did you feel that your expectations, such as continuous communication, advice regarding intellectual property, costs, or expected timelines, were those expectations met?
Well, I'm a surgeon, and that's what I love to do. So everything outside of that is really, when I look at it, it's what can I do to help better patient care? And so I don't know anything, or I didn't know anything about, patents and, product design and working through things. It was all kind of learned on the fly, but Diametrics walked me through pretty much every step along the way, from, recommending patent attorneys to manufacturers of this and that and ways to market. And I mean, they kind of walked me through every step of the way. And I would not be able to have done what I did without them.
And would you recommend Diametrics to develop product ideas to your colleagues, other surgeons?
Absolutely. So I'm working on a couple different ideas with them now that I hope are just as beneficial as the IOL punch that we've already created. And so I think that they're a great launch pad for any idea you may have. And it's a great starting point. And they'll be honest with you. If they think that the idea is not going to work, they'll tell you that. They'll say, hey, look, we're willing to still take the extra steps, but I don't think this is going to work. Or they'll say, hey, I think that's a great idea, but that's not something we do. Now, I haven't come across that yet. Fortunately, they've been able to do everything that I've wanted to do with them, but they're very honest through and through. And it's a family-owned company, which I really enjoy working with as well. And they're just pleasant people.
Dr. Micheletti, thanks a lot for your time. It's been a great pleasure talking to you today.
Oh, my pleasure. Thank you.